The VDRL test, or Venereal Disease Research Laboratory Test, is a diagnostic tool used primarily for the detection of syphilis, a sexually transmitted infection, STI, caused by the bacterium Treponema pallidum. This test is a type of non-treponemal serum test, which means that it detects substances, antibodies, that are indicative of an infection, rather than detecting the bacterium directly. Initially developed during World War II to screen major populations rapidly, the VDRL test continues to be employed worldwide as a quick and cost-effective preliminarily screening test for syphilis. Its primary function is to identify the reagent antibodies that the body makes in response to the syphilis-causing bacterium. The procedure of the VDRL test involves taking a blood sample from the patient, usually from the vein. The blood is then mixed with a special reagent containing cardiolipin, cholesterol, and lecithin. If the patient has syphilis, their blood will contain antibodies that react with this reagent, forming clumps that can be seen under a microscope. While the VDRL test is useful for initial screening, it is not specific for syphilis, which means it can sometimes yield false positive results. Conditions such as pregnancy, certain viral infections, or autoimmune diseases can cause antibodies to be present that may react similarly, leading to these false positives. If a VDRL test result is positive, it is typically followed by a more specific treponemal test, such as the FTABS or TPPA, to confirm the diagnosis. These confirmatory tests look for direct antibodies against Treponema pallidum itself, thus providing more specific validation of a syphilis infection. Despite its limitations in cases of false positives, the VDRL test remains a staple in syphilis screening due to its cost-effectiveness and accessibility, especially in low-resource settings. Health professionals should always interpret VDRL results in conjunction with clinical findings and other diagnostic tests to make accurate diagnoses and proceed with appropriate treatment plans. In summary, while the VDRL test is not definitive, it plays a critical role in public health screening efforts and syphilis management. It is a classic example of a diagnostic tool that balances cost, speed, and practicality with the need for subsequent, more detailed confirmatory testing.